This is my transdermal medication lab video. So first things first, we always want to hear our doctor's orders and it's our MAR. So we want to make sure everything matches exactly and just review it just to give ourselves a good idea of what we're looking at. So John Smith, October 22nd, 1981, October 22nd, 1981, sorry, John Smith, okay, and then the same medication, transderm, etc. Dates match, everything matches. Okay, great. We want to take note of any allergies. So in this case, we have an allergy to codeine. So we want to definitely keep that in mind while we're preparing medication. Double check our medication to make sure there's no codeine in anything, obviously. So then we can go ahead and we can start our 5 rights and our 3 checks. So today, we're going to do our first check from pulling from our medication drawer here. So here I have our transdermal nitro patch. So we're going to do our first check while we're doing that. So right drug, transdermal nitro patch, 0.4 milligrams, John Smith. This would have a label with all this information, obviously. Right root, so apply to hairless skin. Okay, apply to hairless skin. Right time, 8 a.m. Okay, it's 8 a.m. I look at my watch. So then we can go ahead. We want to double check the expiry date while we're at it. And then we can start our second med check. So preparation of the drug, which with a patch, there's not a lot to prepare. So we'll just do our second check. Transdermal nitro patch. Okay, yes, 0.4 milligram, 0.4 milligram, John Smith, applied right root, so topically, right time, 8 a.m, okay, great. So then we can go ahead and do our third check while we're preparing our tray here. So we have a cloth for cleaning, drying, and we have our medication again, transdermal nitro patch, 0.4 milligrams, John Smith, right roots, topically, right time, topically, 8 a.m, okay. So now we're good. We've done our 3 checks and our 5 rights. So we're gonna gather our stuff and we're gonna head to the room. So upon entering, I want to introduce myself. Hello, my name is Monique. I will be your nurse today. I'm going to provide privacy. I'm going to close all the doors and the curtains. I'm obviously then going to go perform hand hygiene. I'm going to wash our hands and we're going to put on a fresh pair of gloves. And then first things first, I'm going to get Mr. Smith to confirm his name and date of birth, and I will compare this against our MAR here and his bracelet. So John Smith, October 21st, 1981. Okay, John Smith, October 21st, 1981. He is oriented times 3. So then we will go ahead. We will go over any allergies. So Mr. Smith, I see you're allergic to codeine. Is there anything else we should be aware of? Okay, just the codeine. All right, great. So we're going to go over additional rights. So the right reason, Mr. Smith, nitro patch is used to prevent angina attacks, so the chest pain you're experiencing. The right education, so we want to let Mr. Smith know that some side effects include dizziness, lightheadedness, flushing of the face and neck, nausea, headache, reddened skin, and rash where the patch is placed. We want Mr. Smith to know he always has the right to refuse medication. And if you're okay with this, Mr. Smith, we will continue. So at this time, we would make sure the rails are down. Bedded is a good working height for me. Just let me adjust this. And then we'll go ahead and we'll start our medication administration. So what we want to start with first is just assess, if we were doing it, for example, on the chest here, we're going to remove any clothes or like little as possible to make them feel comfortable. So we'll expose that area. We're going to want to make sure we take off the old patch right away and dispose of it properly. And then something I could have done even while I'm doing my second or third check is I could have written on the patch itself But since I didn't, I will go ahead now and I will do that. I will open my patch. And I'm going to write the time and date that it is being applied. Okay. And then we're going to go ahead, we're going to make sure we wash, rinse, and dry the area the patch is going on very well, and make sure it's very dry before we try to apply the next patch onto it. Alright, so now we've got our patch that has the date and time of it on. We're going to go ahead, we're going to take the stickies off the back, make sure we get all our garbage in place, and we're just going to apply it right to the, make sure the chest is ready and dried and washed and hairless as possible. And we're going to just hold it firmly for about 30 seconds, and we're going to make sure there's no edges curling up or any contamination or dirt that will affect the adhere, like how it is adheres to the skin. Sorry. Okay, so once that's done, all right, great. We'll just gather any garbage. We're just going to make sure our rails are up again. The bed is in the position that we want it. The patient is comfortable. They're not having any sudden adverse reactions. And we're just going to make sure they're comfortable as possible. Do they need anything else? Blankets? Anything? Do they know where the call bell is? Yes. Okay, we're good to go. Great. So then I would just leave the room. Or I could wash my hands before I leave the room. Either or. Wash our hands. Dispose of gloves. Dispose of all that garbage from the procedure. Then we would go ahead and look at our MAR again. So here we have Transdermal Nitro Patch 8 a.m. So I'd go ahead and just sign that. So we want to make sure with medications like that they are given within a reasonable time that they are ordered. So 30 minutes on each side to maintain that therapeutic effect. For right evaluation, we want to make sure that the medication is adhered properly and is not peeling it up at all so that it can get the full effect of those drugs. Have we seen any adverse side effects up until now? No. We're going to make sure we circle back around in 5 to 10 minutes, make sure there's still everything's okay, nothing's irritating the patient. Has the medication kicked in? How are they feeling? How is their chest pain? Go from there.